it's Dr. Heather, your virtual sports chiropractor, and I think a lot of us have experienced at some time or one point in our life a pounding, excruciating headache, and we've kind of wondered, well, what type of headache is it? Well, I want to go over that with you guys today. I want to kind of go over the 3 common types of headaches that you could possibly be experiencing. Well, the first one what we're going to talk about is known as a tension headache. Now, a tension headache usually is brought upon simply because our traps themselves start really pulling on our neck, and if you are somebody who does work in front of a computer, you could be experiencing more of a tension headache. Now, this type of headache might be a little bit more dull in nature and not be presenting itself in a severe sense or really kind of creating any excruciating eye discomfort, but a tension headache will stay more to the back part of the neck, more localized kind of underneath that head, and usually a lot of times a tension headache, if we do hydrate, if we get proper rest, if we kind of relax those traps a little bit more, or even take that anti-inflammatory, we notice that the tension headache goes away. Now, the next one I want to talk to you about is known as a cluster headache. A cluster headache is brought on by really severe burning pain, and a lot of times a cluster headache might actually start right behind an eye. You could also notice some like redness, flushingness, swelling in the face a little bit with a cluster headache. A headache will also be presenting itself in a series. What I mean by that is you'll go 15 minutes or maybe even a longer duration with that kind of stabbing, burning sensation on that one side. It will disappear and then it will come back again, and then it will do the same thing, and it repeats itself. Now, nobody really knows why cluster headaches really kind of come on, but as somebody who does work more on a holistic approach, doing things on a preventative nature, meaning making sure that we're not sitting in front of a computer or any type of screen for too long of a period, straining our eyes, or that we're not, hydrating our bodies enough, are some of the things that you might want to look at doing to kind of really prevent that cluster headache in occurring. Now, again, doctors will prescribe some type of corticosteroid or anti-inflammatory to help with those cluster headaches, or some type of migraine-like medication to really, again, help alleviate that discomfort that you are feeling. Now, the next headache I want to talk about is a migraine. Now, if you're one of my many females out there, you know that a migraine can be very debilitating. Sometimes migraines also too can be more hormonal based, meaning that you may wind up experiencing migraines more around your menstrual cycle. Again, also too, they have linked migraines sometimes to being triggered by foods in terms of wine, chocolate, cheese, different types of sugars, and things like that. Now, migraines usually occur only on one side of the head, but it will be the whole side of the head, and a lot of times can be associated with nausea, difficulty in terms of with light, so photosensitivity, and maybe also too feeling like they just can't even open their eyes because of the debilitating discomfort. Now, migraines usually do have a very good success rate with medication, because you would also want to know how to kind of head off that migraine. Now, again, the things that you can do from a preventative standpoint when having headaches is to really look at keeping a headache journal. A headache journal actually starts to figure out what might trigger those headaches, whether it is a tension headache, a cluster headache, or a migraine. And then from there, if you did wind up using your chiropractor to do adjustments, is to actually try to do the adjustment to the upper cervical spine before the headache occurs. So what you're trying to do is be more preemptive in that care to keep that headache, discomfort, pain from even occurring, if not giving it a much lesser effect. Now, some of the things that you could also do is you could look at doing a little bit of soft tissue release. Now, especially if it is a tension headache, you could definitely take a look at doing some soft tissue work to the neck, to the upper traps, and in through the shoulder blades. Right there, that should help alleviate a lot of discomfort. And then you could also look at doing some simple basic neck stretches. Now, when it comes to a cluster and migraine, depending on its severity, you may actually not want to do more of a preventative approach at that point. You may choose to actually just go ahead, turn out the lights, take a nap, and kind of take that medication and call it a day. which is completely understandable. But again, from a preventative side, if you went ahead and started doing some work to help increase the flexibility, mobility to your neck and to your mid-back, and looked at just making some other changes, not only to diet, but also to, if you're again working from home, working at the office, making sure your ergonomic setup is designed correctly, it chances are will help lessen those cluster headaches and migraine headaches for you. Again, guys, this was just a little overview on the 3 most common types of headaches that we can experience throughout our lifetime. If you have more specific questions about a headache that you're currently experiencing, leave some comments down below. And if you found this little video helpful regarding headaches, give it a like. And as always, don't forget to subscribe to the channel. This is Dr. Heather, and I'll see you in the next video.